Well, welcome back to the COVID-19 Wellness Series put together by Serve Canada in association with ARRA Arts in support of Trillium Health Partners Foundation. This is part two of the Let's Talk Health. And today we're going to continue the conversation with Dr. Jaya Chanchlani, who is an incredible doctor, as well as Dr. Tina Chanchlani. Again, two wonderful doctors in their profession and the great work that they do in the community, especially Jaya. It's such an honor to have both of them. I'm going to invite our host, Anu Srivastava. She's the founder of ARRA Arts, as well as the host of this series. I'd like to invite her to carry on the conversation.
Thank you, Jake, and welcome again to part two of COVID-19 Wellness Series. As Jake said, we have two amazing doctors with us, and what an insightful conversation it has been in part one. And we are going to continue more talks right now with two amazing doctors who are going to give us a lot of insight into general medicine practitioners. And here I go with the next question. One of the things that a lot of people are finding difficulty in distinguishing is that how can I tell when it's flu or whether I have COVID-19 symptoms or whether I have cold? That's one of the very common things that people usually, because maybe change of weather or whatever it is, that they are not feeling up to the mark and they have one of the normal symptoms which we would have any other years, it would not be such an issue. But this particular year with the pandemic, it's very concerning. And I'd like to invite Dr. Tina Chanchlani to maybe answer that question for us.
You're spot on, Anu. As we enter the colder months, this is a common concern that we're seeing more often in the practice. Unfortunately, many symptoms for COVID and the flu and the common cold do overlap. And so it's hard to know where these symptoms are coming from. I'm going to talk a little bit about some common symptoms for each of these and some symptoms that are more standout. So for the common cold, symptoms are usually mild and can range from a tickly throat to a runny nose, nasal congestion, sneezing, and sometimes there's a fever, but usually not. Common colds are not normally associated with very intense symptoms, and they are also not usually associated with shortness of breath, which can be something that happens more with more serious type infections. The flu and COVID-19 is a little bit harder to sort of tease out the difference between the two because both of them do have overlapping symptoms, including fever, headache, body aches, sore throat, runny nose, cough, nausea, vomiting, diarrhea. And while the flu is less associated with shortness of breath, very intense cases of the flu can have shortness of breath as well. Some of the key differences with COVID-19 and one of the major symptoms that we associate with COVID-19 is a loss of taste or a loss of sense of smell. Both the flu and the common cold don't usually have this. Also, we notice that both the COVID-19 and the flu aren't usually associated with sneezing, and that COVID-19 itself is less associated with runny nose and nasal congestion. But these are very subtle differences, and we understand the challenges in sort of self-diagnosis. So the best thing to do is if you have any symptoms, to contact your family doctor, to contact a walk-in clinic, to contact Telehealth Ontario, and get some advice about whether or not you should be tested. Most places are conducting testing even with one symptom. It's very easy to get tested now. And the testing turnaround time is about 24 to 72 hours in most places. So you get a quick result to know whether or not you have COVID-19.
Oh, thank you, Dr. Tina. I just am amazed. These sound so simple, but these are really very good, resourceful tools for us to self-diagnose as to really which direction we really need to go and if we need to get ourselves COVID tested. Okay, thank you so much, Tina. That was a very insightful answer. Now that we have the winter months coming on us and people are actually now getting out to get the flu shots taken. Now, Does the flu shot really prevent you from getting COVID-19? Dr. Jaya, if you could please answer that question.
Yes. So before I answer that question, I have to tell you a little bit about the flu shot. So flu shot is unique in a way that it's recommended every year. Unlike other vaccines, and this is because there are different strains of viruses every year, and the shots are prepared accordingly. But the efficacy of flu shot is quite low. It's only 40 to 60%. So all these years, when you tell people to get flu shots, they were not very keen because they thought, oh, it doesn't work. What I try to make them understand is, even if you get a flu, after a flu shot, the symptoms are quite mild. You can manage them at home with symptomatic treatment, and you really don't end up in the hospital. What happens every year is thousands of hospital admissions and deaths are due to influenza, and we are trying to avoid that this year because we need those hospital beds for COVID-19 patients because we still don't have a vaccine. So I try to tell them, if you take up beds with influenza, then the COVID patients are going to be without beds. So to answer your question, flu shot does not protect COVID-19, but decreases the severity of influenza so that they don't end up in the hospital, and reduces the burden on healthcare because they don't take up the beds. Now, this year is very important to get flu shot, and I think people are realizing it and they are asking for it, so which is good. Now, who will get flu shot is anybody over the age of 6 months. Now, you might call your doctor's office and they might say, oh, we don't have enough doses because, they're not getting that frequently as they should. But the people who are at high risk should be getting it first. So these are people over 65 years of age, children 6 months to 5 years, people with chronic conditions like heart conditions, lung disease, and diabetes, compromised people, and all the pregnant women can get flu shot anytime in their pregnancy. What people don't know is flu shot does not only protect the mother, but it also protects the fetus all through the pregnancy and first few weeks of life when the child doesn't get any vaccine. So I think everybody should go and try to get flu shot as soon as possible.
Thank you. Thank
Great.
you.
Yeah,
Jake, over to
very
you.
good. Yeah, thanks very much, Anu. Good, very good information about the flu shot and how much it works and whether one should take it or not, especially this year. And I think your advice on and your suggestion on getting it this year being critical to, support the healthcare system, and also for themselves, and of course, pregnant women and the fetus and all that stuff. Some incredible information. Thank you very much, Dr. Jaya Chanchlani. And now I'd like to ask Tina a question. Tina, many people have prescriptions that they need to fill, they need to repeat, or whatever it is, they need to get their prescriptions. How does one manage ongoing prescriptions?
Sure. With the new options for virtual visits, our aim is really to make it easier for patients to renew their ongoing prescriptions. Earlier in the pandemic, the pharmacies were only able to give out 30 days worth of medication, even for long-term prescriptions, and that was generally to prevent panic and drug shortages. However, at the moment, this is no longer the case. You can get your full prescription from your pharmacy. If you have moved out of town for whatever reason, which a lot of our patients have done because of the pandemic, your prescriptions can be faxed by your doctor to your new local pharmacy. How to manage your prescriptions really depends on your medication specifically. So medications that have been recently started may require more frequent monitoring and follow-up, whilst long-term medications that you've been previously stable on might be able to be dispensed for longer periods of time. For example, if your pap smear is up to date, you can likely get your birth control prescription for 1 year. If you have high blood pressure and you monitor your blood pressure at home and your readings have been stable, or if you are a well-controlled diabetic patient and you've had recent blood work, you might be able to get your prescriptions for 6 months. Whatever prescription you're looking at, the best person to talk to is your family doctor, as they know you the best, they know your medications the best, and they'll be able to advise you as to which prescriptions can be dispensed for longer periods of time and which ones might need some closer follow-up.
I just cannot believe the amount of information, both of you doctors. It is just, it's really very, very useful. And this is something that even I can hear a lot of my friends and family actually asking and trying to find the answer to these questions. No, so thank you so much for such a wonderful job that you all are doing, and not only with telling us all the answers to these common questions, but also going out there in as frontline heroes and actually looking after the patients physically. Thank you for that. I think I'm going to move on to my next question, which is there have been obviously different phases of lockdown and the severity of COVID-19 that has happened in the past 6 to 8 months. And different regions and different areas in Ontario have been labeled as hotspots or red zones. In particular, Toronto area and the Peel region has been considered a little bit of a high case area of COVID-19. So I was just wanting to get some insight from both of you. What is like, I mean, how would you consider the difference of the cases coming in, let's say from Toronto versus Peel region? Maybe I can ask Dr. Tina to start first.
For sure. I mean, we've been given a lot of information on what makes Toronto a so-called hotspot. And what's nice about some of the information coming from public health is that they've really been able to break it down by postcode. So what postcodes have more cases, which postcodes have less cases, and perhaps look at the demographics in those areas and suggest what the reason could be. And there's a couple of things to consider when we're looking at these Toronto postcodes. The first one to consider is that many of these areas are areas that we would consider to be of higher population density. Now, we all know that Toronto has a lot of people population-wise, but these particular areas are areas where there are either many people living in a single dwelling or many dwellings that are grouped closer together. And we would think about, is this an area where there's a university where many students might be living in a single dwelling? Is this an area that's close to a hospital? Toronto has many hospitals, all of them filled with essential workers who go to work and come into close contact with patients who could have COVID-19 and then bring them back to their communities. Also, the TTC, which is the only form of transportation for some people, is another hotbed of infection. So there are a couple of reasons why Toronto might be more susceptible to having higher case counts. It's also important to note, I think, that Toronto has many test centers. Our testing capacity and capabilities are large, and we're just going to be more prone to picking up infections for that reason.
That's great information. Dr. Jaya Chanchlani, what do you think is the rationale for the Peel region area for being a hotspot?
So we all know that after Toronto, Peel is the next hotspot in Ontario. So in my opinion, there are a few reasons. Now, Brampton has the highest number of essential workers in trucking and transportation. Also, we have people working in food processing, manufacturing, and distribution areas. Now, these workers cannot work from home, so they have to be out there. And can you imagine if one of them is infected and goes to work, there is potential of hundreds of infections at work. Pearson International Airport is situated in Mississauga. It employs most of the local people who come from Peel and who are in contact with thousands of passengers going in and out of the airport. Most families from here travel to Pakistan and India, and as you know, with cases going so high in India, when they come back, some of them bring back these infections to Toronto. Also, we have multi-generational housing in Peel region. Up to 3 generations can live under the same roof. So this child who goes to school brings the infection home, gives it to not only to siblings and parents, but also to grandparents who might have comorbidities and might end up in the hospital. Lastly, as everywhere else, this is just not the Peel, everywhere else, people should stop having large weddings, large backyard parties, and big family gatherings, in my opinion.
No, thank you so much, Dr. Jaya and Dr. Tina. You're so right, and that really truly explains the differences and yet the rationale of having the hotspots in both these areas. Over to you, Jake.
Thanks very much, Anu. just a little humor. At one time, if a city was called a hotspot, it was the destination to be at, but not anymore. Not anymore. Wanted to ask, and Anu alluded to this earlier. Both Dr. Chanchlani's, Anu and I have been doing this series for a while now, and we've received great information. Really, really good, solid information. I tell you, today is wonderful because you've really answered a lot of questions that, as Anu said, are common questions, but people just wonder, especially amidst COVID-19. And you really brought it down to common terms, and which is really wonderful. I think it'll be very informative for those watching this series. So thank you again for being a part of this conversation. Wanted to ask you, Dr. Jaya Chanchlani, being a doctor, you would know a lot of the resources that are available for people to cope during this crazy global health crisis. What are some of those resources that people can reach out for?
Yeah, sure. So, if you're looking for resources for COVID-19, there are tons of them out there. But I just believe in very simple things like, okay, just go on publichealthontario.ca. Just remember this simple thing, publichealthontario.ca. I'm not going to give you so many of resources because then again, it's very overwhelming. Now, this is a website which has all the information you're looking for. Simple things like how to wash your hands, wearing masks, social distancing. Two, like how to self-monitor your symptoms, how to self-isolate. Now, if you're going for something specific, like you have a school-going child, so if you're looking for that information, so they have information about how to manage when you have a school-going child, you have an elderly patient at home, elderly person at home, or in long-term care. It also tells you where you can get the COVID testing done. Because a lot of people are still confused, and these test centers, I know they keep changing sometimes. So it tells you where exactly you can get the test done, and people are very anxious as to how painful it is and how is it being done. So it even tells you how is it done and what do you expect after the test. I have so many patients calling very anxious. When am I going to get the results? I'm not getting the results. So this tells you exactly how long it's going to take, where you have to get it done, and what to expect. So this is a great, great website, very simple. I'm not going to give you more than one. It's called publichealthontario.ca, and hopefully you'll find everything you're looking for.
Very good. Very simple. And as you said, all that information will be available there. And that's terrific. Thank you very much, Dr. Jaya Chanchlani. And thank you to you as well, Dr. Tina Chanchlani. Very insightful information, very useful and helpful information. Anu, I want to have you wrap it up before I
Yes.
talk about some funding for Trillium.
What a great conversation it has been. We have had two incredible doctors with us who have been practicing general medicine, and they have answered so simply the questions which actually have been in most of the people's minds in the past 6-8 months. And thank you so much for making it so easy and so simple for us. And I am really privileged to have known Dr. Jaya Chanchlani for the past 30 years. And it is just incredible to see the wonderful work that you have been doing, not only as a medical doctor for the past 30 years, but also as your Chanchlani Foundation and all the wonderful work, all the philanthropic work that is being done for the health research through University of Toronto and through McMaster University. Indeed, it has been a privilege to know you, and thank you for everything that you've done for the community, both you and Vasu Chanchlani. Thank you so much. I think it has been a wonderful series so far, and there's a lot more to come. But I'd like to also thank Jake Dheer, who has been very, very active in the community. He is in the board of the Trillium Health Partners Foundation, and he is the moderator for our series. And I'd like to thank our technical producers, Y Media team, Yudhvir Jaswal, Preet Jaswal, and the rest of their team. Thank you so much. Over to you, Jake.
Well, thank you very much, Anu, and really thank you to you as well for coming up with this idea of this COVID-19 Wellness Series. Especially during this time of need of making sure that everybody, we and ours, are looked after physically and mentally. What an incredible series! With Serve Canada in association with ARRA Arts and in support of Trillium Health Partners and the Trillium Health Partners Foundation. Folks, on your screen, if you're able to donate, this is a very festive, religious, celebratory time during the next few weeks and months. And if you're able to give, please do give whatever you can to support our frontline healthcare workers, to support our hospitals. And again, thank you very much for being a part of this journey of the COVID-19 Wellness Series. As Anu said, there's more to come, and we hope that you find it informative. Certainly, Anu and I, during the course of discussions that we've had with various doctors and health professionals, and like we did today with Dr. Jaya and Tina Chanchlani, what great information, and I hope you find it useful, resourceful, and do take care of yourselves and those around you. Take care, and God bless you. We'll see you during the next COVID-19 Wellness Series.